Hello, it's Dr. Yates. We're going to talk about eyebrow restoration. So let's take a look. Let's go right to the meat, okay? A lot of patients come in, they look like this, and you can see that eyebrows are still there, but they're very minimal. How does somebody get like this? 9 times out of 10 is from over plucking. Sometimes we'll see people with a history of hyperthyroidism where the eyebrows become thin, or extreme hypothyroidism. They can also get very thin as well. So we see a lot of this, and a lot of people come in with tattoos, and honestly, there hasn't been any person that came in with tattooing of the eyebrow that I couldn't tell across the room. So when people think that these things are good, they're okay. They're like a placeholder for something better. So we do eyebrow transplantation, where we actually take hair from the scalp and put it where your eyebrow should be. What are the functions of eyebrows? You can see eyebrows are something that you don't miss until it's gone. And what it does, it softens your appearance, because everybody has these orbital rims and ridges that is basically the eye socket. And just having hair over this protrusion of the orbit softens your look. When you don't have hair there, you look different. So before, here's after a Dr. Yates special eyebrow transplantation. And this was done in the standard fashion with FUE. We don't make any cuts. We take hair from the side, from the parietal region of the scalp. Usually to do a restoration like this is anywhere from 250 to about 400 grafts per each side. And the things you should notice, that to do it properly, the eyebrow basically has 3 sections. And you can see here, this is this orbital ridge. If you don't have any hair there, it just looks just too uncomfortable. You don't want that. So the eyebrow is basically just follows the orbital ridge. Nothing too fancy. A lot of people who want to have a high arch in their eyebrow, we don't do that because they can tailor them and style them to do anything you want. But there's some basic rules that you follow. The nostril back is usually the starting point. The lateral point of the eye is usually where you stop as far as the eyebrow. And they're basically 3 sections. The head of the eyebrow is here, and then there's the body and the tail. We usually concentrate on really making this head thick. We'll use multi-grafts here in this area here. And you can see on the model here that we've done, these are all multi-grafts in here. And you have to be sure that you're orienting them the right direction, or they're going to stick out like a porcupine. So these are going in the direction they should. In here, we have less multi-grafts. This is called the body. The tail is kind of all singles, because it should just kind of float out like a cloud on that lateral side. But this is what it should look like. And eyebrows are very reliable. I have not seen one not grow. So if you don't have eyebrows and you're fed up with tattoos, even if you have a tattoo, we can put hair on top of it. You're still in the game. But just know that it can be done. It can be done well. But like anything else, you got to know what you're doing. So come see us. Thank you.